little bit. How's everyone doing today? We're gonna continue our presentations on digestive health. I'm gonna just get my other streams ready to go. Make sure they're actually coming through all right. Just give me a few seconds here, a few minutes. Okay, so over here. Yeah, if you're on my Instagram, what you gotta do, I highly recommend just going over to YouTube. It's much easier to look on my YouTube account. But if you're on my Instagram, you can still ask questions. So, of course, got to check my volume real quick. So, testing, 1, 2, 3. Okay, so the benefit of y'all being on a live call is they can actually ask questions along the way. Just going to do some testing, making sure these things are working. All right, so welcome to our live call today. The title of our video is Constipated. I pray this video finds you. Okay, so I want you guys to really look at your digestive health objectively, because many of y'all, you don't pay attention to any of this until the situation is way severe. Now, I want to give you guys a really healthy dose of liabilities concerns and also practical pessimism regarding your digestive health. And today we're just going to go over what we've been going over the last couple of weeks, looking at our human physiology, recognizing what exactly is the digestive system and how we can improve upon it. Now, many people all over the world were chronically constipated. Now, how do you define chronic constipation? If you're not going to the bathroom every single day, you're chronically constipated. If you're brushing your teeth every single day, you're showering regularly, going to the bathroom once a day, twice a day, should be a KPI, be at the forefront of your mind. Now, if you're not accomplishing this, then you need to find something to improve and get that KPI back. Now, looking at our digestive system, it's just a very long piece of pipework. I did not study medicine. None of this professional medical advice, diagnosis, or treatment. You guys have to do your own research and find out what's right for you. I'm going to be presenting information, presenting different protocols that are out there. but it's still up to you to go and do the research for yourself. Work with your doctor, naturopathic doctor, the integrated medicine, to find the winning combination for you so you can recover this important KPI. Now, food enters your mouth and down the esophagus, and it enters your stomach next. Your stomach produces digestive enzymes to break down the food. Then food enters your small intestines next. Your small intestines is 4.5 meters, followed by the large intestine, which is another 1.5 meters in length. Your digestive system is categorically the same across the board. Doesn't matter what your religious beliefs are, your background, political beliefs, your skin color, eye color, none of that stuff matters. We need to see that this is just a very long piece of pipework. This is just an illustration to simplify your digestive system. Over here, once again, food enters your mouth, down the esophagus, into your stomach. Then food enters your small intestines next, the 4.5 meters, which is about 15 feet. Then it enters your large intestines, another 1.5 meters, and out the back for elimination. When we're looking at our digestive system, recognizing it's a very long piece of pipework, but give you a little bit of perspective, just how long is this pipework. When we're looking at NBA basketball, from the floor to the basketball rim is 10 feet off the floor or 3 meters. When you're dealing with your digestive system, the system is so long, it's kind of like having one NBA hoop stacked on top of one another. So this combined height is 20 feet or 6 meters. And that's how long this pipe is. Now, through years of eating, you're experiencing any form of chronic constipation. I was just like many of y'all out there. I was huffing and puffing, begging and pleading on the toilet. I got veins popping out on the side of my temples. But what did I do? What did I get after all that work? Nothing. Now, many people, they're chronically constipated and they have a lot of waste material trapped inside their colon primarily. Over here, this is your large intestines, the ascending portion, transverse, and the descending portion, and out the back for elimination. Now, when your elimination is incomplete, residues of old feces can build up in layers on the walls of the colon. As they putrefy, they can cause health problems, pain, and discomfort. Now, as we're looking at our body, looking at human physiology, this gives us a better understanding how to fix chronic constipation. Because if you go to see any doctors, they may begin with some type of laxatives you can buy over the counter, and they may work in the short term. But throughout this presentation, I will tell you that many people, it stops working for them. They might be go see some GI specialists, and they may not even have answers for them after taking prescription strength medication. How do I know chronic constipation is a big problem across the world? Well, I did a bit of a keyword analysis. Keyword analysis tells me everyone, many people all around the world, they're searching for constipation relief online every single day. It doesn't matter what the stock market is doing, real estate. Even if the economy goes to shit, okay, there will be many, many people searching for constipation relief because it's that big of a problem. And the search volume only increases year over year, not just in the English language, in Spanish, in Russian, Portuguese, Tajik, Arabic, I don't care, Chinese, Japanese, Korean, everyone in the world looking for constipation relief. Today I'm going to share a simple protocol with you that has helped me, my family members, and hundreds of people around the world. Now, I want you to get these ingredients at the grocery store. So follow through on these directions carefully, because my directions are very specific, and they're specific for a reason. You may find other protocols online outlining self-flush protocols, constipation relief, different keywords like that. Now, many people fail because they may be mixing in these ingredients in the wrong proportions. Not only that, they are drinking it in their own way. They don't follow a specific set of directions. This is where you're going to get at the grocery store. You're going to get yourself some apple cider vinegar, Then you're going to buy some citrus fruits. You can use limes, lemons, or grapefruit. Next, you're going to buy some pink salt. If you don't want to use pink salt, you can also use food grade Epsom salt. So write that down, food grade Epsom salt. Not just any regular Epsom salt, because most Epsom salts that you find, they're for soaking, they're not for consumption. Black coffee is to prepare separately. Over here, I'm going to give you a screenshot so you know your shopping list. Over here, you have bottled water. The bottled water is 2 liters in volume. Get yourself a metal mesh screener. Over here, you have a single press squeezer. Single press squeezer for your limes, lemons, or grapefruit. Then you're going to get some measuring cups. The measuring cups must be accurate. They must say the amount of milliliters on them. This is the apple cider vinegar. Over here is the pink salt. You can get a lot of pink salt at Costco. Then you're going to find yourself a stainless steel thermos. The stainless steel thermos that has a volume over 1 liter or over a quart, okay, in volume. And also another stainless steel cup for black coffee, which is prepared separately. Okay. So over here, back to the ingredients: apple cider vinegar, limes, lemons, or grapefruit. I recommend using grapefruit. I think they're the best tasting. And over here, this is how you're going to mix everything in the stainless steel thermos. Okay, so we're going to be working with the stainless steel thermos, putting these ingredients in. Now you can screenshot this. There's going to be a little bit of a fasting period. The night before you finish dinner around 7:30 p.m., you're not eating any late night snacks. You can still drink liquids, but you're not eating anything. Next morning when you wake up, same thing. You can have some liquids, but you are not eating breakfast. At 11 a.m. on an empty stomach, I want you to make this in a stainless steel thermos. You're going to add 1 tablespoon and 2 teaspoons of pink salt or food grade Epsom salt in the stainless steel thermos. So that's 25 milliliters salt total using pink salt or food grade Epsom salt. Next, you're going to cut and squeeze 3 lemons or limes, or use 1 grapefruit. I want you to filter it through the metal mesh screener over here, so you're removing any type of pulp, any type of seeds from the solution. I don't want any constriction, anything that you can cause you any type of obstruction. Then you're going to add a 1/4 cup apple cider vinegar in the stainless steel thermos. Then you're going to add 2.5 cups of hot water and stir it up. Okay, that 2.5 cups, stir it up. You can stir it up for 30 seconds, 45 seconds, making sure that it dissolves evenly. Next, you're going to add a cup of room temperature water and stir. You kind of bring back down the temperature of the salt flush solution. I want this solution to be quite hot. It's not going to be burning you, but it's got to have some temperature. When we are dealing with protocols like this, hot expands, cold contracts. What are we trying to do here? We're trying to clean out both the small and large intestines. This is a solution that you drink down, okay? This is not an enema. You may find many different videos online regarding coffee enemas, water enemas. This is not one of those. This is a solution that you drink down, and it's got to work its way through the small intestines, begin cleaning out the small intestines. The small intestines is 4.5 meters, 15 feet, and it has a surface area of a football field. And over time, the salt flush solution is going to bring all that waste material in the large intestine. The ascending side of your colon is on the right-hand side, okay, of your body. And then it's going to work that waste material through the transverse and finally down and out the back for elimination. That is the goal. We want to bring this solution, prepare it in this set of proportions, so you're not just mixing things randomly. Why do people fail on the salt flush protocol? Well, this is only for people that are mildly constipated. Maybe you're only 1 to 2 days chronically constipated, and this may be the right thing for you. And work with your doctor, naturopathic doctors, to find what's right for you. People are mixing in the wrong directions, and you can't wait until the solution is completely cool. So after you mix in everything in the stainless steel thermos, there are only 3 items on the desk. You have water, sulfurous solution in the stainless steel thermos, and also black coffee. No cream or sugar added on your table. There's no item on this table that you can actually break, such as glass or ceramic. I want to make sure you're using only items that are unbreakable. Because if you make anything in a glass container, something that's going to break, this is going to produce a laxative effect. You're going to be running to the bathroom. As a result, you may be knocking things over. I don't want you to knock anything over to harm yourself, because you're going to be running to the bathroom. The floor is completely wet with glass. You may slip and fall and you cut yourself. The next thing that you know, you're finding yourself, you're at the ER. And people at the ER, they can't figure it out because you're shitting out of your behind. And you got all this glass cut up on your body. And they ask you, what the hell did you do to yourself? And then you say, oh, I watched this YouTube online. Please don't mention me. You're on your own, okay? Everything is your responsibility. I've already warned y'all. Now I'm going to teach you guys how to drink this, because a lot of people mess this up. Number one, it's not a race. You are not racing, trying to get specific results, like very urgently. You want to be as relaxed as possible. Even before trying to drink this, I want you just to listen to some music that can get you into a very relaxed mindset. And when you're breathing through your nose, and then you can feel your diaphragm moving up and down, your stomach moving up and down. That kind of deep breathing. Because many people, they are very, very tense, so they're breathing in their upper chest area, and that's not what I want. I want you guys to do this on an empty stomach and gradually drink this down. This is how you're going to do it. You're going to take a tiny sip of this water, hold it in your mouth, then you're going to take a bigger gulp of the sulfurous solution, drink it down, and you're going to sip on this black coffee. Okay, so over here, taking a tiny sip of this water, hold it in your mouth. Because when you first start drinking this, you may not like the taste. So this tiny bit of water kind of recoats over your tongue and also your teeth. Next, you're going to take a bigger gulp of the sulfurous solution. As long as it's not burning hot, try to put it down. Okay? Then you're going to take a tiny sip of this black coffee to reward yourself. That's a familiar taste. That's what we're looking for. So step one, take a tiny sip of the water. Step two, take a bigger gulp of sulfurous solution. Step three, taking a tiny sip of this black coffee, reward yourself. Going through this over and over again. But the goal is to finish the sulfurous solution first. You want to put this down in the stomach. You guys can also screenshot this. Now, if you do not like the taste of the sulfurous solution, you can get yourself a stainless steel straw. Using a stainless steel straw can help you bypass the taste of the sulfurous solution. I've done this hundreds and hundreds of times since 2019, so I'm used to the taste. But for many of you beginners out there, you may not get used to it. That's why I highly recommend using grapefruit, because with grapefruit, there's a little bit of sweetness to it, and the fragrance is going to help you put this thing down. Now, the sulfurous solution, you can take your 45 minutes, 1 hour, an hour and a half. If you try to drink it too quick, then you may throw it up. Anytime you have this feeling of, oh, I'm feeling like the sulfurous solution is somehow back in my esophagus, I feel like I'm about to throw up, well, don't do anything, just set everything aside. Go back into that deep rhythmic breathing, listen to some classical music, Rachmaninoff, so that sulfurous protocol can bypass the pyloric sphincter in a relaxed environment into the small intestines. Once those, feelings or this urge to throw up subsides and goes away, then you continue to drink. Now the sulfurous solution becomes too cool, I want you to somehow heat it back up and continue drinking it. Okay, so it's definitely not a race. You're going to just pace yourself drinking through this. And after you drink it, you can take some slight walks. You can do some light stretchings. Sometimes I take my mind off the whole thing. Don't be so outcome dependent, like I must have this laxative effect. I'm reading these other testimonies online. John's got a lot of people all across the world in different languages, and and you're so attached to those results, right? Instead of doing that, I want you just to browse around on YouTube, find something maybe like comedy, something that you like to watch that can take your mind off of the whole thing. But in the back of your mind, you're so focused on drinking this salt flush solution and putting this salt flush solution down first. You're not trying to put down the water and the salt flush together combined. No, don't do that. There's a certain viscosity. I don't want you to dilute down the salt flush solution. This got to go in first so they begin to do its work. If you try to push the water and the salt flush together, that's about 3 liters of water. You're going to feel very uncomfortable, and you may not have that laxative effect because you've diluted down the salt flush solution. After you drink the salt flush solution, just wait, do some light stretchings, and eventually you may have that unction to go to the bathroom, okay? And you're never forcing anything out into the toilet, never straining. You just let it fall, okay? And if it's not there, get back up again. Continue to do some light stretchings, okay? Sometimes you may burp along the way, and that's perfectly fine. That's just the way how the salt flush is working its way through the small intestines. Now, you have some poop milestones you can capture down. The solids are going to begin to come out. When it first came out for me, it was so dark. It was like pitch dark charcoal color, like my t-shirt. Because over years of eating and then over years of chronic constipation, the outer lining of the large intestine is completely encrusted with fecal matter. It's not getting out. So when people are having bowel movements, they're not getting a real bowel movement. There's only a certain segment in the colon, this middle section, that is pushing out the waste material. There's a lot more to where that came from. Oh my goodness, I have a lot of stuff to share with y'all. And you just let that waste material to fall out, and then it's going to gradually transition to soft poop. Then it's going to transition to really, really soft poop. When that happens, I want you to continue to chug this water safely. Go at a pace that you're comfortable with. This water, because you've been only sipping on this water, you were not drinking it. You're going to take this water bottle, you may even take it into the bathroom with you and drink it. As you're drinking it, you're exhaling the air through the nose. You're putting extra water pressure down the digestive tract because right now it's pushed out all the debris from the small and large intestines. Even the salt flush protocol that you just drank earlier is in the toilet. All out, and now you're adding more water pressure on top to really further cleaning out the small and large intestines, which is going to create an incredible diarrhea tsunami. Many people don't believe me when I first explain this to them. They think that this is just hyperbole, this is exaggeration. I make it a believer out of them after their first time, many people. Simply because if they actually follow my directions to a T, and if they're only mildly constipated, I would potentially recommend this for people that are mildly constipated. They're mixing it in the correct proportions. Not only that, they're drinking the salt flush protocol in a very specific way as well. And that's going to help you clean out the small and large intestines combined. What you'll notice is that when this torrent brown water coming out, you're adding more water pressure with the water bottle. More and more is going to come out. Because sometimes you just get back up from the toilet and you sit right back down because you're just blasting this stuff out. Blasting it out. And that watercolor is going to transition from a very, very dark brown, and over time it's going to become lighter and lighter and lighter. And that's what we want. That's how we know we're making some progress. What did we just do? We talked about human physiology 101 regarding digestive system. We know it's a very long piece of pipe work. And through years of eating, many people are chronically constipated, not just in the colon, but also a lot of debris trapped in the small intestine. And when your elimination is incomplete, those residues of all feces, they build up in layers in the walls of the colon. As they putrefy, which is decay and rot, they can cause health problems, pain, and discomfort. We're getting all that waste material out, the small and large intestines comprehensively. And afterwards, while you're on the toilet, you can also consider getting yourself a squatty potty, or you can get yourself a stool, an Amazon box, I don't care, cardboard box. Make sure it's sturdy. Make sure you're not going to trip over it and harm yourself along the way, make things worse. We're not designed to use the bathroom at a 90-degree toilet. Okay? Human beings, we are designed to use the bathroom in a squatting position. So get yourself a squatty potty or get yourself some type of a stool. Another tip I can give you is simply lift up the toilet seat and sit on the toilet directly without the toilet seat. The toilet seat itself is going to squeeze on your butt cheeks and it's going to squeeze in the anus. Of course, people are going to have problems defecating, getting that waste material out of their body. When you're done with the protocol, you can see that the water is coming out very, very clear. This is what I want you to do. You can start eating some probiotics, okay? And also you want to supplement with some electrolytes. You can eat some fruits, such as watermelons. Get some coconut water back into your system, because when you're drinking all this water, even though you're not really absorbing it, it's flushing out a lot of electrolytes from your body. What you want to do is replenish those electrolytes with watermelon, coconut water, different types of fruits, something very, very soft you can put down. Sometimes people, they eat congee, they eat oatmeal after this, something soft. Now, if you're not hungry, that's perfectly fine. You can just drink those liquids, the coconut water, the watermelons, watermelon juice, and even a little bit of pink salt. That's fine. You can add a little bit of pink salt into your coconut water, kind of replenish those electrolytes along the way. I think that's a really winning combination. So you have some sugar, some natural sugars from the coconut water, but you also have a little bit of pink salt with the trace minerals to help you replenish back to your body. People are having all sorts of problems across the world because they cannot fix their digestive health. Now, I also want to share with you, this is one of many different protocols that are out there available for you, depending on how severe your chronic constipation is. Let's just say your colon is very, very congested, okay? Nothing is going out. You haven't gone to the bathroom for days at a time, talking about 6, 7, 8 days or more. There are people out there with that condition. You may need a colon hydrotherapy. Look into something like this. Colon hydrotherapy is something that you can do where you're just laying down on this apparatus and the colon hydrotherapists are putting in hot water through your back end. Putting hot water through your back end to get the waste material escorted out of your body. You may have to begin here before even using my protocol. You guys understand? Because your situation is so severe and you may have to go in every single day for a whole week. Just help you get your colon back to normal. Because some of y'all, it is that severe. It is that problematic. So what I'm going to do now, I'm going to spin through my social media to see if there are any questions I can help answer along the way. Also checking my sound, making sure my sound is coming through. So I noticed my sound isn't all that great, but that's all right. Sometimes gotta play through these, you know what I'm saying? I'm also on Twitter. Also on Facebook. You guys can reach out to me on Facebook if you have any questions. I can help you along. Of course, I am on Rumble, also Twitch. And the benefit of y'all being on this call is that you can ask me questions along the way. And that's going to really help you. So oftentimes you don't know what to do, right? And everyone, your situation is going to be a little bit different. And I'm not saying I have all the answers. I had to piece this puzzle together over time by myself. I had this problem, chronic constipation, I was going to CVS, buying preparation H because I was dealing with hemorrhoids, and there wasn't a really good solution that was out there. Not that I could see. Maybe you have really good solutions out there. Maybe you can share. Love to hear from you and what's worked for you. Right. This seems to be the protocol that's worked for me time and time again. I've used it over 5 years. Now, I'm only doing this once a week now. Before, I was doing this about 2 times a week, and now it's just once a week, kind of just get everything out. Because I just think of this kind of like maintenance. When you're brushing your teeth, you take your showers, but we haven't been taught to actually clean ourselves from the inside. And that's what we're here to do. We're here to clean ourselves from the inside to learn about detoxification as we are eliminating the waste material out of our body. Then we can restore the functions of our body. Without this in place, it's very, very difficult. I also want to share a lot of liabilities concerns with you guys because most people don't look into this until it's too late. I'm going to have a little bit of coffee and water before I jump on the next set of slides. So over here, what are we trying to do? We're trying to go from the picture on the left to the picture on the right. And we're just looking at the colon. Now, a lot of people, they're just packing so much waste material in their colon, and they're not doing anything with it until it's too late. Well, how severe can it possibly get? Because most people, they make fun of chronic constipation like it's a joke. This is no laughing matter because there are people that are ending up with a toxic megacolon, and it becomes very life-threatening. This is a life-threatening complication, inflammatory bowel diseases. They can be painful and cause permanent damage to the large and small intestines. They include ulcerative colitis, Crohn's disease, and infections caused by this other colitis. Toxic megacolons characterized by swelling and dilation of large intestine due to the inflammation and accumulation of a large amount of gas. Just because I'm reading this online, different medical websites online, that does not mean I agree with everything that they write. I can almost guarantee you that this is more than gas. This is the waste material that you've eaten all over the years, still trapped in your colon. All the McDonald's, all the Burger Kings, all the Bojangles, the Cracker Barrels, the frozen pizzas, the 7-Eleven hot dogs, all the chips that you've eaten, there's still remnants of it stuck in the colon. You can go back, and some people, they have months and months of just putrefied remains stuck in their colon. Some people, they're so severe, they have to go to the hospital and get their colon completely removed because it's become so inflamed, it no longer works. And the doctor said, well, this thing is just full of trash. It would be a much better option for you to remove this colon completely. Now you may wonder, well, what happens next after you remove your colon? How does the waste material exit out of your body moving forward? Well, they have a lot of other operations lined up for you. And these are the practical pessimisms I want you guys to take note of. Take careful note, because there's a lot of them over here. Let's just say there is something wrong with the descending portion of your colon, and they do something called a left hemicolectomy. They remove this portion right here, and they reconnect the rest of the parts. Okay, so this part removed, remaining sections they join. They look at your body like a series of USB ports that can just plug and play. That's how I see it. Or over here, let's just say this particular area is completely diseased. This section is removed because over here they had this bulging, descending portion of their colon. It's become very diseased, so the doctors remove this completely. Well, how does the poop go from this area to this area? Well, they install something called a colostomy bag. Okay, they create a whole colostoma in the abdominal wall, which allows the waste to leave the body. A colostomy bag attached to the stone soma to collect the waste. Talk to people in the medical profession. Maybe you have a friend that's working as a nurse, maybe some type of a PA, physician's assistant. They see this all day, every day. And the numbers, they're not decreasing, they're only increasing over time. Over here, something went wrong with the ascending portion of your colon. Over here, the doctors performed a right hemicolectomy, and this is the part where the small intestines attaches to the large intestine. This is the appendix. If they perform this surgery, a right hemicolectomy, they plug and play again, they reattach. They get the small intestines to reattach to the remaining section of the colon. Now, when the colon is completely removed over here, they may have to do this procedure, which is called an ileoanal anastomosis. They're using the portion, the end portion of your small intestine, create a pouch around the anus so the waste materials can still exit out of the anus. The problem is that you're going to have many watery bowel movements daily. And one of the functions of the colon is to extract and pull out the water from the feces formation. Without that function, it just falls out. So many people in the hospital, they have a lot of bowel problems. They're on adult diapers, okay? And some people, they aren't even that old. They can have something like this in their 30s or 40s. So if you're dealing with chronic constipation in your early 20s, you must do something to resolve it. Not through medications, not through this X, Y, and Z, but really get into the root of the problem. Here's another problem. A colon severely displaced. A colon that is healthy has an ascending transverse, has a slight tilt to the upside before the descending portion back down. Over here you can see her colon, only 23 years old, all over the place. It goes up, then it loops back down, then it loops back up again. This is probably in her chest area before the colon makes its way back down for waste elimination. Just imagine when she's standing up, all the waste material has to fight against gravity just to get to this point in the colon before making its way back down and out the back for elimination. Practical pessimism all day, every day for y'all, so you guys can recognize the early signs in advance and find a solution that is right for you. Diverculitis is also on the rise, another gastrointestinal disease. This occurs when pouches called diverticula start to form in the GI tract, become inflamed and infected. This condition commonly occurs in the Western population, can be seen in 10% of people over the age of 40 and 50% of people over 60. The rate of this disease typically increases with age. Scientists believe that this condition is due to not eating enough fibers. Not eating enough fiber leads to constipation, which puts extra pressure on the colon walls. And this causes diverticula or bulges to form the weak areas of the colon. The risk factors for diverculitis may include age over 40, male, overweight, eating a low-fiber diet, eating higher fat and red meat, not enough exercise, taking non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, steroids, opioids, smoking. Moreover, the signs and symptoms of the condition include pain, tenderness in the left lower side of the abdomen, nausea, vomiting, chills, cramps in the lower abdomen, constipation or diarrhea, rectal bleeding. What a mess over here, right? So you got these pouches, inflamed areas of the colon, and some people, they may get so severe, the doctors, they would do the hemicolectomy, like we discussed earlier. Over here, you have ulcerative colitis, inflammation in your colon. Now, people with UC experience periods of symptom flare-ups, followed by periods of remission without symptoms. The signs and symptoms include diarrhea, bloody stools, abdominal cramping, and weight loss. Treatments include medication and surgery. That's what they got for you. They always got a lot of medication and surgery. Well, what kind of medications are we talking about? We're talking about corticosteroids, immunosuppressants, and biologics. Many of these drugs are immunosuppressants, which means they suppress the immune system. Temporarily, you're not seeing the symptom flare-ups. But did you really resolve the root of the issue? Just throwing this out there for many of y'all, you're on a lot of antibiotics, maybe dealing with SIBO, any type of bacterial overgrowth, and the doctor, they're just nuking your microbiome with antibiotics. Now you're getting that ulcerative surface because without a microbiome, that protective layer, this is what could develop. Over here, what is Crohn's disease? Another gastro disease, part of the IBDs, inflammatory bowel diseases. This occurs when there's inflammation in the small intestine and colon. The main symptoms of Crohn's disease are diarrhea, stomach aches or cramps, blood in the stools, tiredness or fatigue, and weight loss. It is thought to believe Crohn's disease caused due to genes, a problem in the immune system, smoking, a previous stomach bug, and an abnormal balance of gut bacteria. The risk factors for this condition include family history, smoking, certain medications like antibiotics, birth control pill, non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, high-fat diet. So now inflammation is no longer just in the large intestine, but also in the small intestine. As we're reading through these different types of gastro diseases, you can see these signs and symptoms are very, very similar. Doesn't matter if you're talking about Crohn's, ulcerative colitis, or diverticulitis. You have a combination of diarrhea, stomach aches or cramps, blood in the stool, tiredness, fatigue across the board. Now, here's something that is also very common when people are having chronic constipation. Look into this. This is called rectal prolapse. So people are huffing and puffing on the toilet. They are trying to squeeze things out. There's always that feel of, oh, I'm almost there, okay? So you are trying to get the waste material out, and you may have the sensation of, okay, if I could just push this a little harder, if I can just twist my stomach a little bit more, then I'll get the waste material out of my body. I used to be like that, and what happens is that when people do this for a prolonged period of time, they're putting a lot of pressure around their anus, and their rectum is actually falling out. This is a prolapsed rectum. What else could possibly happen when you're just squeezing on the toilet for a very long time? They say you may develop anal fissures. What is a fissure? A fissure is simply some type of a crack or breakage, a split. It could be very, very painful. Once again, people that are sitting on the toilet for a very long time, or they're developing some type of hemorrhoids. Hemorrhoids or piles, these are swollen veins. They could be internal or external, and they could be very, very itchy. They could cause rectal bleeding. They could be very, very painful. Okay, and for me, I was developing these years ago, and I was going to CVS buying Preparation H. It was so embarrassing, but I'm very thankful I no longer have any of these, because when you are talking to your doctor and you're asking them, what is the root cause to my rectal prolapse, my anal fissure, my hemorrhoids, they may say something like this: while several factors are thought to be linked to rectal prolapse, there's no clear-cut cause. An estimated 30% to 67% of patients have chronic constipation, infrequent stools, or severe straining, and an additional 15% of diarrhea. In the past, this condition was assumed to be linked to giving birth multiple times by vaginal delivery. However, as many as 35% of patients with rectal prolapse never gave birth, and it can occur in men. There might be some genetic predisposition to this condition. In other words, some patients are more prone based on their genes to develop this condition, while others don't. They like to throw this stuff in there to mess up with your mind. I really think this is a form of gaslighting. They already told you right here, 30% to 67% of patients with chronic constipation. But on the other hand, they tell you, well, there's no clear-cut cause. Well, they may send you to a proctologist. They're called bottom whisperers, and they're ready for you with their latex gloves. What are these guys? Well, these guys, they're highly specialized medical doctors. They're called colorectal surgeons. They could treat the whole entire gastrointestinal tract, but specifically the issues involving the rectum and anus. They're going to examine you, and they're going to say, well, we're looking at some internal and external piles. We may have to do some surgery there, kind of patch up your anal fissure, kind of tuck back in, your prolapse. Now, did they really solve the root of the problem? I want you guys to always to ask yourself, am I treating the symptoms or the root cause? If somebody's dealing with chronic constipation, they're dealing with the waste material not going out from this colon. They can't go from the picture on the left to the picture on the right. The proctologist is fixing things left, right, and center down here, but if you're not resolving this permanently, you're not restoring that daily KPI of daily bowel movements, guess what's going to happen? You're going to see this guy again, because you're going to develop new hemorrhoids. You're going to develop new anal fissures or prolapses. Do you guys understand what I'm talking about? So over here, I'm going to just send through my videos real quick, see if you guys have any questions. Welcome, welcome. Somebody's on my YouTube. Appreciate you. Welcome, welcome. And you can ask your questions. Don't be shy. We all have different digestive issues over the years. I'm still learning how to improve my digestive health. There's always another level of health that you can unlock. I've been on this health journey for quite some time, over half a decade now. And every single year, and I wake up with a lot of enthusiasm because I know my health is in an upward trajectory. Not only that, I'm finding new protocols I can do to better enhance my health. Isn't that great to know that, well, there's always another level of health I can unlock. And I find that very, very optimistic. I find that very, very exciting because there's something I can learn, right? So over here, da-da-da. Checking through, making sure. So I also want to share some messages and make some people upset. I don't care. Sometimes you got to put yourself in the shoes of other people that are in constant pain and struggle due to their chronic constipation. And recognizing that, hey, people are getting upset if I share some of their comments. There are a lot of anonymous members across the internet, many, many thousands and thousands of forums online, Facebook groups, private Facebook groups, dealing with chronic constipation. Since they've gone down the path of looking at the GI doctors, looking at different specialists, and still not resolving their issue, let's read, because you don't have to go so far down the line. Look if there are potential detours that you can avoid going forward. Sorry to be crude, but there's a big lump of poo that won't come out. What do? Anyone, any idea, suffering from constipation now and again, especially when I've been eating crap the past couple of weeks. I've been constipated. When I go to the toilet, nothing is coming out, or if it does, it's hard. I've also been bloated, especially upper tummy. I'm like a trapped wind, feeling plus since yesterday, not really got an appetite. Tried Ducales, never really worked. Eating more healthy and now trying lactose since Tuesday, but feel like it's just making me fart. Also to mention having some stress and anxiety with family members been in hospital. What can I do to help get my tummy back to normal? Thanks. Okay. Let's read some other things. What's the longest you've gone without poop? 4 weeks. Was hell. I was throwing up feces. Unblocked myself suppositories eventually. This is an example of feculent vomiting, okay? And it does happen. And if I would just do some rough estimates, there are probably around 60,000 cases in the United States per year. People that are just throwing up their feces because they can't poop it out. I'm so tired of this. This morning I was driving, all of a sudden it hits me. I didn't make it to the bathroom, all over my shorts and car seat. I'm so incredibly exhausted from this. I'm to the point of wearing adult diapers. There was a lot of mucus. This is normal. Definitely not normal. Okay? I'm so backed up. My stomach is very bloated. Looks and feel I'm 9 months pregnant. This is affecting my quality of life. Getting depressed. I've tried so many things and still not able to clean out. Now pay attention to some of these. I'm impacted. All home remedies, OTC laxatives, enemas, dietary changes, additions, nutritional oils, quit working last month all of a sudden. The ER couldn't reach it. Enemas didn't work. Highest dosage of lenses does nothing. And the Miralax colonoscopy prep is giving me overflow diarrhea. Small bits are coming off the impaction, probably from the hospital enemas I got Saturday. What else can I do? I feel like the impaction is just way too big to get out. Seems like nothing is softened enough. Hello, I've been struggling with severe chronic constipation for a couple years now, but it's only gotten worse over the past 6 months or so. I've been prescribed Trulance and lenses, highest doses for both, and neither of those medications are working very well for me at this point. I can pass a little bit of stool, but not so much. But not much so I'm constantly extremely backed up. I have to spend about half my waking hours lying down because I'm so bloated and nauseous and often in pain. You guys need to pay attention to this. As far as OTC laxatives, nothing really works there. Either Ducalax, enema, suppositories, magnesium citrate, nothing works. I was supposed to have a colonoscopy today, but can keep the bowel prep down. The procedure had been rescheduled for a month from now, and one of the nurses at my GI office prescribed a pill-based cleanse. The pill is called Sutab, and I was warned ahead of time that patients often had trouble completely emptying their bowels with this pill, so given my struggles, I am doubtful that this will actually work for me. Here's my question, has anyone here gone to the point where nothing works? Meds were OTC laxatives and had to have sort of in-office medical procedure done? I am so sick and so miserable. What about fascial colonics? I'm not even sure how those work. If anyone has any advice or experience with this, I'd be very grateful if you could share with me what you ended up doing and what the outcome was like. Thank you. So for this person, not professional medical advice, diagnosis, treatment, you definitely want to work with an experienced colon hydrotherapist, maybe going for a couple weeks in a couple days in a week, just to get that waste material out. Later, you want to do my self-flush protocol, also cleaning out the small and large intestines combined. And later on, we're going to deal with internal parasites. I'm going to talk about that next because most people also ignore internal parasites. Internal parasites are very, very real, and they're going to cause additional obstructions in the digestive tract. Most people do not believe parasites are a real thing in a first world country such as the United States, Germany, Switzerland, the UK, Sweden. Listen, they are in your food that you buy at Whole Foods. When you go to Whole Food Market, people can see with their natural eye, without even microscopes, there are worms in their salmon, or there are worms in their Costco salmon. Parasites are everywhere. Today I'm just going to go through a few of them, but you guys can actually visit different parasite museums. This is the one in Japan. They have 60,000 specimens in this one, and about 100 different parasites can harm the human body. In the United States, they also have a national parasite collection that they've been collecting since 1892. So over here, they got over 100,000 catalog lots. All right, a lot of different parasites. There are people, they are just collecting them and studying them every single year. They're finding new parasites. Over here, these are full-blown organisms that can harm you and also your pets. We have the liver fluke, the pinworm, the tapeworm, also roundworms. That can cause all sorts of havoc in your body. Liver flukes are very common in cows and also sheep. Their eggs, they will first begin hatching in water, and they'll work their way up through different organisms they're going to attack, such as snail. Their intermediary hosts grow to a certain size. After they grow to a certain size, they exit the snail, end up on some vegetation. Well, the cow or the sheep come over, eat this vegetation, and that's how they get it into their body. And if you're eating undercooked meats, that's how you get it into your body. This is something that the ranchers have to deal with every single year. Doesn't matter if you're in Montana, Colorado, Idaho, if you're in Australia, New Zealand, if you're ranching, they have to deal with liver flukes every single year because they're finding their livestock is getting weaker, they're losing hair, they have no appetite, they're getting sick. Well, these liver flukes are causing all sorts of problems. And they're going to attack your liver. Your liver is a storage of vitamins and minerals, so they're going to attack it, extract the nutrients, continue to survive and replicate. If you're taking notes, just write down survive and replicate. That's what they do. Over here, you may be dealing with specific parasites that attack the kidneys. Once again, these parasites may end up in a worm, and then the frog or the fish come over and eat this worm and work its way up the food chain. Over here, you're eating this frog, undercooked frog or raw fish. That's how that parasite get into your system. Steak tartars, another risk factor. People that are eating a lot of intestinal products, sushi, sashimi, hot pot in Asia, causing a lot of risk. Tapeworms, they're in cows and also pork. They're also in fish. Okay, they work their way up the food chain. This is what they look like, and their anatomy is simply this. This is the head portion. They're hermaphrodites, so they can reproduce all by themselves. They have these things called progonids. Each progonid can hold up to 100,000 eggs. Now, one of the reasons why people are taking all these laxatives, still not working, because you may have parasites that are so big in your body right now, they're causing so much additional obstruction. Somebody pulled out a tapeworm that is 59 feet. Somebody in Thailand pulled that out. Look at all that tapeworm. Now that's only one tapeworm. Over here, tapeworm in your cats. Even the cat is freaked out. This is roundworms and an American bully. And over here, this is some type of a botfly. Okay, very, very possible some type of a larvae, a botfly. The risk factors are from your dogs, from your cats, your drinking water, if you're traveling abroad, going to the Amazons for your ayahuasca. If you're not prepared, you're going to be drinking contaminated water, a lot of raw foods, even raw vegetations. And don't take these risks. Like people, when they're young, they're like, oh, I'm going to eat a slug. Somebody dare me. That's dumb, because there are a lot of parasites in slugs. And somebody, they actually ended up in a wheelchair. You guys can look that up. Somebody ended up in a wheelchair because he took a dare. His schoolmates told him, hey, I dare you to eat that slug. Parasites can go outside of your digestive tract, begin to attack different organs of your body, or end up in your muscles, or even end up in your brain. This is called neurocysticercosis. Many different places in Asia, they are eating raw foods, even raw blood. Don't do that. Pinworms are also very common. You can find them in children, also adults. People that are scratching their behind discreetly. According to PubMed, you have over 1 billion people around the world from all socioeconomic classes. Over here, roundworms are also very common. You can find them in many different pets, also in rabbits and ducks. And this is affecting from 800 million to 1.2 billion people worldwide. Don't you think that's a lot of people? 800 million people to 1.2 billion people worldwide. This is just a picture of different white blood cells. The white blood cells, they do have the ability to take care of your internal parasites. The problem is that many people, they're on corticosteroids or they're immunocompromised. So if you're taking corticosteroids, you're basically telling your white blood cells, don't go to work. Do whatever you want. And they're not taking care of your internal parasites. In that environment, the parasites continue to survive and replicate. Zoonotic diseases, okay? People are taking these type of photos online. That's how parasites can get into your system. Another form of destruction. Some people, they have way too many roundworms, so they have to pull them out through surgery. They have to extract that many roundworms out of their colon. Now, just imagine, if you have that many roundworms in your small and large intestines, how does the waste material supposed to get out of your system? Doesn't matter how many laxatives you take. Doesn't matter if you eat right, if you're eating more fiber. You have way too much obstruction. Different parasites attacking your liver. These are also roundworms getting pulled out of the human liver. So we're not dealing with Animal Planet. This is not, okay, different animal photos. This is humans dealing with this. So look into these different herbs. You got clove bud, you got wormwood, membazidol, okay? You can also have black walnut, wormwood combination for your dogs. Look into Panicure C for your cats. Look into Frontline Warmer, Advocate, work with your vet. Some of you may need prescription strength, albendazole, or this other one, or this one. This is not prescription strength. Over here, there are many different products on the markets. Find the winning combination for you. I rotate through different anti-parasite products because there are so many different parasites, and each different product will target different parasites. That's my goal. Now, over here, you want to get good with my protocol first. Cleaning out the small and large intestines, going from the picture on the left to the picture on the right. Really understand how your digestive system works. Very long piece of pipe work. And you got to get really good cleaning out this pipe work first before you target internal parasites. Many people, they don't know how to go from the picture on the left to the picture on the right. They start to take all these different anti-parasite medications, right? Well, they still haven't figured out how to get this waste material out. So not only do you have this waste material that is giving you more inflammation, now you have the dead parasites, the dead carcasses that's also not exiting. Solve your problems one at a time. That's my sincere recommendation. You want to look at your body as a system. It's like, okay, I'm gonna clean it out. I want to restore my bowel movements. And over time, I'm gonna take different anti-parasite medications or herbal blends, working with my doctor, naturopathic, integrative, but I'm still going to do something to flush out the dead parasites. Does that make sense? This is the approach that I went the last 5 years. And right now, I don't have any of these digestive problems at all. I'm very grateful. I'm able to use information to help my family members, and each family member is a little bit different. So how I coach each person is a little bit different. And you may need that type of coaching for yourself, because I don't know what you've done, what kind of specialists you've seen, and maybe we could be a good fit working together. Now, who am I? I'm just another regular guy. Before I was going to the gym, I had workout programs, a personal trainer, but I still had a lot of inflammation in the body due to chronic constipation. So when your body is inflamed, it holds on to excess water and also excess fat. Now, over time, I learned about this protocol, and I learned how to clean myself from the inside. And this is basically what I look like all year round. I don't really go to the gym. I haven't gone to the gym for years. But I do work out. I know how to take care of my health. But it's not just about working out. It's about restoring your internal organs on the inside. And when you do that, your body slims down. Your metabolism returns. It just works miraculously like that. I was going down a very dark path in this situation. You can see how my whole face is very inflamed. No longer. Every single week, I'm doing something to improve my internal organs. There are people on my website or on my YouTube, they're finding a lot of success with just watching my free videos. See that I did your protocol last night? Holy crap, I was not prepared for what came out. You have helped me so much. I just purchased your program to support you. Thank you and many blessings to you. And I hope many of you will also experience this type of success. I want you guys to find protocols that are right for you, and you will find success getting your bowel, getting your situation resolved, whatever that is. And you also can work with me one-on-one. If you want to work with me one-on-one, you guys can go to my Instagram, and we're going to get on a call. Getting on a call kind of lets me know, hey, where you are at currently. If you want to just jump on a call with me real quick, you can just go on and get on a call with me by just sending me a DM so I can send you a Zoom link, okay? And helping us find the next right step for you. We have so many exciting topics to discuss going forward, not just improving our digestive health, but also improving the conditions of our internal organs, such as our liver. Your liver is an amazing organ. You need to protect it. You need to upgrade it. You need to get the congestion out of it. There may be a lot of congestion in your gallbladder right now in the form of gallstones. All these things can be flushed out of the body. Or you may have intrahepatic stones that can also be flushed out of the liver. Is it going to take effort? Is it going to take a lot of persistence? Of course. But if you want vibrant health, and I think most people, they want vibrant health, okay? Because without vibrant health, you're always in and out of hospitals, or you're going to different seeing specialists day in and day out, and you're still not getting your problem resolved. But once you start to clean yourself on the inside, then you start to restore the organ's function. It begins to filter your blood properly, and you're going to feel better and better. Maybe you're dealing with different chronic pains, maybe joint pains, this discomfort here, that skin condition there, they go away. And that's what we want. Many of you are putting up with problems for such a long time. You never really look into what is the root cause to these problems. And over time, if you're interested, we can also talk about how you can improve the conditions of your kidneys. I started doing this kidney cleanse beginning of August last month, August 1st, 2024, just using different herbs to clean out the condition of my kidneys. I'm not going to wait the doctors tell me that I have problems with my kidneys. I'm going to assume there's always room for improvement, and there are different herbs that I can use that are very inexpensive that's going to help me clean out my kidneys. And I've been doing it the last couple of weeks, and I've seen a lot of improvements already. So I want to encourage you guys with that. Thank you so much for watching this video. And if you have any questions, you can reach out to me in the comments below, or you can go on my Instagram, send me a message, work with me one-on-one. But for most of you, you should just get my program. If you're just mildly constipated, if you think that's right for you, work with your doctor, naturopathic doctor. I really pray this video finds you, okay? So thank you so much again for watching this. Look forward to hearing from you, and I'll talk to you soon.